It's the lower. In such scenarios, flapless surgery becomes quite feasible. Even employing direct drilling, we anticipate no substantial loss of soft tissue volume, representing a highly advantageous situation. The punch technique is not ideal. Instead of using a punch, it's better to simply employ the direct drilling method. Now, for the number 7 site, the position and angulation must be determined very carefully. I expand it, and then I assess the overall bone quality. After assessing the bone quality, I will decide how many millimeters deep to insert it. Right now, I'm planning to place a 4.5 millimeter diameter implant. I'll decide on the length after checking the depth. Given that the bone quality at the bottom is notably dense, even if the upper bone is less firm, it's crucial not to under-prep. You must adequately drill to the precise full diameter needed. That way, the implant will engage well at the bottom and gain good fixation. If you under-prepare, the implant won't go in. Okay, the depth. I corrected, adjusted, and achieved stability. I measured stability.